morbidity indicators, or more actually are morbidity indicators. So the morbidity indicator is a value that describes the presence of disease in a population or the degree of risk of an event. So basically, the morbidity indicators are the indicators that describe the risk or the burden of disease in a population or the risk of an event that may occur in a population. So if you want to know the risk of any event or a degree of that risk or event in a population, you can measure it by the help of the morbidity indicators. And the example of those morbidity indicators can be, you have already read those. These are incidence, prevalence, and different types of incidence, which include the attack rate, the cumulative incidence, the incident rate, incident density. So all of these are rate, ratios, and proportions. All of them are basically the examples of the morbidity indicators through which you can measure the the degree or event of an illness in a population. So basically, this is the definition of morbidity indicators. So what is a ratio? First of all, so these are actually the examples of different morbidity indicators, or how you can measure morbidity using these indicators. So one of them is ratio. Ratio expresses a relation in size between two random quantities. So for ratio, बहुत आसान है. I think you must have read that in second year as well. So ratio के अंदर क्या हो रहा है? There is a comparison between two random quantities. So ratio expresses a relation in size between two random quantities, and the numerator for ratio. So for an equation, you already know that we have a numerator and a denominator. So for ratio, the numerator is not a component of the denominator. It's not necessary that for a ratio that numerator has to be the component of denominator. It can be related to the denominator, or the numerator cannot be completely related to the denominator. So it is not a hard and fast rule for a ratio that the denominator and numerators must be same. So that's okay if the denominator and numerator are not related, or if they are related, that's fine too. So for numerator and denominator, they may involve an interval of time, or maybe instantaneous in time. And the same point that I have shared with you all, that the numerator and denominator can be related or unrelated to each other. The ratio is the result of dividing. So you are going to take the ratio or divide two quantities, or compare two quantities from each other when you take the ratio. So it is expressed as x ratio y, or x's to y, or x by y. Methods, so the formula for calculating this ratio is, we have number or rate of events, items or persons, etc. in one group, which is divided by rate, events, or items, or persons in another group. So you're going to divide two quantities from each other when you're taking the ratio. And the important point is that the numerator and denominator may not be related to each other. They can be related, or they cannot be related. It's okay when you're taking a ratio if they are not related to each other or unrelated to each other. So some examples of ratio include a doctor population ratio, sex ratio, child women ratio, death to case ratio. These are the examples of ratios. For example, if we are taking the number of children with scabies at a certain time, and we are taking a ratio, we are dividing it, or we are comparing it with the number of children with malnutrition at a certain time. So over here you see that the numerators and denominators are completely unrelated to each other, because on the numerator we are taking the number of children with scabies at a certain time, while on the denominator side we are taking the children with malnutrition at a certain period of time. So that as I already discussed, that the numerator and denominator can be related or cannot be related to each other. Okay, so what is the usage of ratio? Why do we use that? So we use it as a descriptive tool or as an analytical tool. As a descriptive tool, we can describe the male to female ratio of participants in a study, the case to control ratio of the study, or the ratio of cases in control in a study. As an analytical tool, we can ratios can be calculated for the occurrence of disease or death between two groups. You make a comparison of an occurrence of illness or death between the two groups when you're taking ratios. So these are the examples of different type of ratios. Another example is like of men enrolled in a follow-up study. There are 3,151 men that were non-diabetic and 189 men which were diabetic. So we have to calculate the ratio of non-diabetic to diabetic men. So over here you see they have already described or defined their numerator and denominator. So on the numerator you have the non-diabetic man, on the denominator side you have the diabetic man. So we will divide 3,151 by 189. So the ratio is 16.7:1. So you all can see that the men that were non-diabetic, that were 3,151, and only 189 were diabetic. So the ratio is, so this is how you calculate the ratio between two quantities. So here you can compare compare between these two quantities or between these two groups. So it's a comparison. When there is a ratio, there is a comparison between two quantities, and you're taking the ratio of it. So another example of ratio is or usage of ratio is that it can be used to calculate the death to case ratio. So for death to case ratio, it is used to measure the major severity of illness. For example, the death to case ratio for rabies is close to 1. That is, almost everyone who developed rabies dies from it. Whereas the death to case ratio from the common cold is close to 0, because no one from cold actually dies. If anyone who acquires cold, not everyone dies from it. But when you compare it with the rabies, so the majority of the patients who acquire rabies or who get the infection, they die from it. So basically, this is one of the examples of ratio, which is the death to case ratio, which is used in order to measure the severity of illness on a scale. So these basically these are some examples for ratios. Then you have proportion, which is another measure of another morbidity measure. So proportion is a ratio which indicates the relation and magnitude of a part of the whole, and the numerator for the proportion. You see that the numerator is always included in the denominator, because for ratio you have already mentioned that the numerator can be or can not be relevant to the denominator. But for proportion, it is important that for the numerator to be a part of the denominator, and it is usually expressed as a decimal fraction or a percentage. The formula is the number of persons or event with a particular characteristic, and you divide it by the total number of persons or events of which the numerator is a subset. So for example, you have number of children with scabies at a certain point in time, and you divide it with the total number of children in the village at the same time. So you see that the numerator is a part of the denominator. They are not completely unrelated to each other. So the numerator and denominator are related to each other for proportion. Okay, then we come on to the third measure of morbidity, which is rate. Rate is a measure of the occurrence of some particular event, development of disease, or occurrence of death in a population during a given period of time. It indicates the change in some event that takes place in a population over a period of time. So it indicates the change in some event or that occurs in a population over a period of time, or changes in a occurrence of disease or illness. And rate comprises of the following elements. So you have a numerator, you have a denominator, you have a time specification for it, and you have a multiplier. Either you take 1,000 or 100 as per, it is up to the beholder. So the time dimensions is usually a calendar year. And the rate is expressed per 1,000 or some other 10,000 or 100,000, selected according to the convenience or convention to avoid the fractions. So that is according to the beholder, the multiplier that you are multiplying it with. So the rates are particularly useful for comparing disease frequency in different locations at different times or among the different groups of people with potentially different size population. That is, the rate is a measure of risk. So for rate, we are actually measuring the risk of a disease during a certain period of time or during a particular time or mid-year population. So for the examples of rate, we can calculate the death rate. The formula for death rate is, how do we calculate death rate? Number of deaths in 1 year divided by the mid-year population and multiply it by 1,000. Then for survival rate, we have a total number of patients alive after 5 years, and you divide it by the total number of patients diagnosed or treated. So that is basically the formulas for rate. And why do you use that? What is the usage of rate, or the example and a basic example for rate that will make it easier for you to understand? So a rate describes how quickly a disease spreads in a population. So why are we measuring a rate? In order to describe how quickly the disease is spreading in a population. For example, there are 70 new cases of breast cancer per 1,000 women per year. This measure conveys a sense of speed with which the disease occurs in a population. Okay? And seems to imply that this pattern has occurred and will continue to occur for a foreseeable future. So if you want to predict the future, the foreseeable future, and predict the spread of disease or predict the degree or spread of the illness, you use rates. We use a rate. ठीक है? Then we have the cumulative incidence. What is cumulative incidence? So cumulative incidence is it is the number of new events or cases. As we already know that for incidence you have to have new cases in the on the numerator side, and divided by the number of individuals in the population who are at risk. So the patients who are at risk do not have the disease, and they are at risk of acquiring the disease. So for the denominator, you have to make sure that the individuals, they do not have the disease, they are at risk of acquiring the disease. But for the numerator, you have to make sure that you have to include the number of new cases of disease in the population. So basically, it is used to predict the risk of why do we use this cumulative incidence? We use the cumulative incidence to predict the risk of disease over a longer or short period of time. So it is the proportion of people who develop the outcome during a fixed block of time, and also known as attack rate, risk, probability of disease, developing disease, and incidence proportion. The important point that you have to keep in mind when you're studying cumulative incidence are that the pre-existing cases of the disease cannot be included in the numerator. You only have to include the number of new cases in the numerator, and the people who already have the disease or who are incapable of having the disease are excluded from the denominator. Like अगर हम कोई patients ले रहे हैं जिनको endometrial carcinoma है या endometrial C है, तो उनको हम cases में अगर include कर रहे हैं, but for the denominator you're not going to take you're only going to take the population at risk who do not have cancer or who haven't been undergone hysterectomy, because these females can be excluded from the denominator when you're solving any problem related to that. So you're only going to take those patients or those individuals or those females that are at risk of acquiring CA, not those that already have had hysterectomy. ठीक है, तो आपको न्यूमरेटर और डिनोमिनेटर में इस चीज का ध्यान रखना है. So the calculation is based on the presumption that all risk individuals are observed for an equal period of time. So these are the 3 points that you have to keep in mind when you're studying incidence or when you're solving any problem related to incidence. The formula is number of new cases of disease or injuries during a specified period of time and divided by the population at risk, okay? Or the size of the population at the start of period. So for instance, you have to make sure that you are taking the population at risk for the denominator. So the example is the month of January is chosen as the study period. A total of 220 patients have passed through the ICU during the month. Of these, 20 were admitted with a diagnosis of pneumonia. So 20 were admitted with a diagnosis of pneumonia, and 10 people out of that developed pneumonia during this stay. Only 20 were admitted with the diagnosis of pneumonia, and only 10 people who were admitted developed pneumonia during their stay. So these were the new cases. So what is the cumulative incidence of pneumonia? So we will take the number of new cases that developed pneumonia during their stay, which is 10, and divided by the population at risk. So a total of 220 patients, they passed through the ICU during the month, out of which 20 admitted with a diagnosis of pneumonia. So we already know that this population is at risk of acquiring pneumonia, or because they have already been diagnosed with pneumonia. So we will exclude those 20 patients and we will consider only 200 patients, which will be our denominator. So when you multiply it, you get 5% in 1 month period. So this is the cumulative incidence of pneumonia. Okay, so I've discussed the rest of the points. You can read it later on from the slides. So then we have the incidence rate. Which is calculated by dividing the number of new cases of disease by the total length of time that each individual of the population was at risk, and which is expressed as the person time or person days. So for incidence rate, the denominator is person time or person rates, and you take the number of new cases of the disease and divide it by the person time, which is the specific denominator for incidence rate. And what is a person time? Person time is actually an estimate of actual time at risk in years, months, or days, and it is basically specific for the denominator for incidence rate. And what is it? It is the sum of all person years for each study participant until one of the 4 endpoints are reached. Either there is an onset of disease, either there is death or migration, either it is lost to follow-up, or basically the fourth outcome is, or basically it is the end of the study. So you're going to approach that individual during the entire phase. So then you get the person time or person days as your denominator. So the numerator of incidence rate is the number of new cases identified during the period of observation, and the denominator is basically the sum of the time each person was observed total for all persons, and this denominator basically represents the total time the population was at risk. So we are considering that the total amount of time the population is at risk, and we are going to consider that and until the four outcomes are reached. I've discussed those four outcomes until basically those outcomes include the onset of illness, or there is death, there is loss to follow-up, there is migration, or either this is the end of the study. So you're going to follow these individuals until this time. And it's basically describe how a disease occurs in a population. So this is the usage, or this is the basically the purpose of incidence rate. The formula is the number of new cases, which is same, but the denominator is different, which is the time for each person was observed total for persons, for all persons, which is the person time. Okay, in months, in years, or in days, for how much time you're following that individual. Actually, there's one example for that. The Black Women's Health Study followed 30,330 women for development of hypertension from 1997 to 2001. So you are following these women from 1997 to 2001, and none of the subjects in this proportion of this study had hypertension at the beginning. At the beginning, none of them had hypertension, but 2,314 had developed hypertension by 2001. So you're following these ladies, and these out of these 30,330 women, 2,314 developed hypertension by 2001, and the women who were studied contributed 104,574 person years of hypertension. So basically, this is the person years. So this will be the denominator for sure. So you mark it as your denominator, which is 104,574 person years of hypertension free observation time. You have to calculate the incidence rate for this group. So for you have number of new cases. The number of new cases that developed hypertension by 2001 are 2,314. So you take it as your numerator and you divide it with the person years, and you get your answer, which is 2,215 cases per 1,000 person years. So you get 0.02215. You multiply it by thousands, you get 2,215 cases per 1,000 person years. Okay, so this is the example for for how to for you to calculate incidence rate. Though, so in the end, we have the last measure of morbidity, which is prevalence. You all have already read this, I think. Prevalence, it is the total of all individuals who have an attribute or disease at a particular time or during a particular period, and you divide it by the population at risk of having the attribute or disease at that point in time or midway through the period. So basically, prevalence is the number of, it is not the number of new cases, it is the number of existing cases of disease in a population. So you're considering the old and new cases, and you divide it by the total population. For incidence, you have the population at risk. Here you have the population, the entire population, not the at-risk population, the total population. So it basically refers specifically to all current cases, the new and old cases at a given point in time or over a period of time in a given population. And basically, we know that that prevalence is dependent upon two factors, which are the incidence and duration of illness. So to formula high prevalence, we already know that it's incidence times the duration of illness. The duration of illness can be the cure of the disease or either death. So prevalence actually is dependent upon these two factors, the incidence and the duration of illness. What does that mean? This means that if the incidence of a disease decreases and the duration of illness decreases, then basically the prevalence will also decrease. And if the incidence of the disease increases or the duration of the disease also increases, then the prevalence of the disease will also increase. So it is dependent upon these two factors. So basically, prevalence is increased by the longer duration of the disease, if the incidence increases, and prolongation of life without care. So basically, all these three factors are the factors that make the prevalence increase or rise. When they are on the higher side, then the prevalence will also rise. and prevalence will decrease if there is improved cure rate, and if there is the duration of illness is short, and if the incidence is decreasing. So all these factors will make the incidence decrease. Basically, there are two types of incidence. There are two types of prevalence. We have point prevalence and we have period prevalence. So point prevalence is refers to the prevalence that measured at a particular point in time, and it is a proportion of persons with a particular disease or attribute on a particular date. In simpler words, you can say that point prevalence is a prevalence of a disease at some point in time, or at a certain point in time. So if you are considering a prevalence of a disease at a certain point in time, when you're describing that it is at this point in time, then it's the point prevalence. The formula is the number of current cases, all new and old, of a specific disease at a given point in time, and you divide it by the estimated population at the same point in time. Okay. But for period prevalence, you refer to the prevalence measured over an interval of time, and it is a proportion of persons with a particular disease or attribute at any time during the interval. So for period prevalence, you're considering, or you're taking how many people have had the disease at any point in time during a certain period. So you are defining that how many people have had the disease during this period, or during this period of time, during the certain period of time, and you divide it by the mid-interval population at risk. So for the period prevalence, you will see that if you want to elaborate the definition, you will say that some people may have developed the disease during this period of time, or some people may have not developed the disease, or they have recovered from the disease, or they have cured or died from the disease, if you're following them during this period of time. So the important point is that every person represented by the numerator for period prevalence have had the disease at some time during the specified period. So this is for the period prevalence. So this is basically the difference between the period prevalence and point prevalence. Then we have one example for point and period prevalence. So the figure below shows that there are 10 new cases of an illness from October 1, 2014 to September 30, 2005 in a population of 20 persons. So it's a population of 20 persons. And each horizontal line basically represents one person, and the solid line represents the duration of illness. So you see the arrow, the arrows are describing the date of, the first arrow is over here mentioned describing the date of onset of illness. The cross represents the date of death, and the upside arrow represents the date of recovery. So you have to, for these, you have to calculate the point prevalence on April 1st, which is April 1st, 2005. You have to calculate the point prevalence for this time. And then you have to calculate the period prevalence from October 1, 2004 to September 30, 2005. So for point prevalence, what you're going to do, you're going to take the number of current cases, and then you're going to divide it with the population. So how you're going to take that? You're going to take, there are 7 cases, number of current cases. So if you count 1, 2, 3, 4, 5, 6, and 7. And for the, if you see the formula over here, you have to take the estimated population at the same point in time and the number of current cases. So if you take the number of current cases over here from April 1, you have 7 current cases. If you count them and you divide it with there were 20 persons, you will not take 20 cases, you will take 18 as your denominator, since 2 of them have already died before they reach April 1st. So over here you see a cross, which is the date of death. So this second person, person number 2 expired over here and before reaching April 1st. And another person is person number 8, which expired before reaching April 1st. So you're going to minus these patients, and you're going to take 18, not 20, as your denominator. Multiply it by 100, so you get the point prevalence at April 1st, 2005 is 38.9 or 39%. Then for the period prevalence, you have 10 cases. You're going to count all the cases from October 1 to October 1, 2004 to September 30, 2005, and you're going to consider all the persons. So you have 20 cases, and you see over here in the question. In the question, it says that that number of new cases of illness from October 1 to September is 10. So the that 10 new cases of illness from October 1 to, you're going to take this as your numerator, because this is the number of new cases, and you divide it with 20, which is the population, the estimated population.